Awesome. Thanks so much. Hello, everybody. Happy Thursday. Getting through the week unscathed. And the event that we haven't met, my name is Jerry Wagner, FMO account executive. And we're going to spend some time today talking about what is no longer the elephant in the room. And just in discussions, we thought it would be a good time to do this. You're going to see more of this as the year progresses, but we thought we'd get in front of it. I'm sure many of you are aware of our fixed indemnity product, and I do want to highlight it now that we're still in the springtime, because I know as summer moves along, other priorities start to happen, and the next thing you know, it's going to be September, and we won't be able to sell the short-term products, and it's going to be a what do I do now? So obviously, pretty much everybody's aware of the recent ruling that we anticipated, and it's finally here. I want to spend just a blink of an eye of time on that. And then I want to talk about our alternative that we do have as we move into September. So just really briefly, and again, I'm sure everybody by now is up to speed on this. CMS finally ruled on short term, and it's going to take on a little bit different flavor, at least from our perspective, as compared to the last time this happened when we were curtailed to 90 days. I'm not reading all this. This is just copy and pasted from our approved talking points. September 1st, obviously, we're not going to be able to sell any variation of the current short-term plans, which includes our short-term, and it also includes our tri-term plans. I would look for more messaging from us probably here in the near future in terms of how we are going to go about handling current tri-term medical plans. I know there are some carriers out there that are starting to come out and say, this is what we're going to allow you to do in terms of rewrites. We have not done that yet. My fingers are crossed that if somebody's currently on a tri-term plan that maybe runs into 2025, that we would be able to rewrite that. But I don't know as of yet. We will be determining that, again, hopefully in the near future. So stay tuned. As soon as I find out, you guys will know too. However, the other thing with that is, in terms of the letter of the law, you cannot sell these past 9/1. I would also anticipate us coming out with a final receive date on these applications, and it's not going to be September 1st. So the ruling draws a line in the sand on 9/1. We'll determine how we're going to handle that getting into August. But look for a big buy now strategy on short-term and tri-term. One last massive push that we'll be announcing prior to that ruling going into effect, and then we'll see what happens in the future. We are in an election year. The last time this happened, and it was pared back to 90 days. We had a different administration, and then all of a sudden we get the advent of a 3-year short-term. So we'll see what happens. The other thing with that, though, when I said this time it's a little bit different, we are not going to be able to stack short-term policies. So you remember the infamous 3x4s that took place after the last time it was pared back to 90 days. We cannot do that this time around. So it is a 3-month and then 1-month extension. And again, I don't know what that looks like. But again, post 9/1, no more tri-term as it stands today, no more short-term as it stands today, and it goes to this 3x1, and I don't know yet how United is going to handle that. So what are we left with? These are our 3 core medical products, the way we look at it today. We are left with our Health Protector Guard, which is a fixed indemnity plan. It is not guarantee issue. There are family members within the HPG plan that are guarantee issue that offer just a more pared back inpatient hospital, ICU, hospital admission type benefits. But by and large, most of the plan families within the HPG do come with simplified underwriting, and we'll broaden that a little bit more as we go along. So the first thing, elephant in the room with the fixed indemnity plan. Had multiple conversations already on this, saying, what are you guys going to do? You know, you get to 9/1, whatever. Well, it's our FI. I mean, and then of course, all of our ancillary. We're not going to talk about the ancillary today. We've done sessions on that already. We've got a new dental, new vision, new accident. All that stuff is still going to be okay. But it's fixed indemnity, and I won't sell fixed indemnity because it has no stop loss, and I don't want my clients hung out to dry in the event that they've got a big bill. I completely get it, totally get it. I'm going to talk a little bit about how some agencies that do a lot of fixed indemnity actually sell the fixed indemnity. The first thing I will say is I would not sell that in and by itself, just personally, to a prospective client. You're going to want to stack, bundle, wrap, package, whatever the terminology is, with different types of plans, insulate that client as best as they possibly can. And more on that to come, right? But that is the big thing, and I completely get it in terms of the underwriting on it. So it is not major medical coverage. This is the other thing that needs to happen, 9-1. The fixed indemnity product got left alone. It was in the bullseye as well, but previous carriers filed suit the last time, and maybe it's being left alone because of that. But one of the things in print, in marketing print, it has to be updated to include specific verbiage. So we're going to have to do some of our marketing docs over so that the consumer knows this is not major medical coverage. It does not meet minimum essential coverages. The thing is, though, there's no QLEs. Obviously, as you probably know, you can sell it year-round, and there is medical underwriting on these particular plans. In the event that, pretty sure everybody here knows this, but at any rate, fixed indemnity, it's $1 coverage. There's no deductible. The benefit is paid per person for each eligible medical expenses. We'll take a look at that here in a second, regardless of the actual expenses, regardless of other coverages. Issue ages, primary and spouse, 18 to 64 in 11 months. So this is a pre-65 product. It does not transcend into the Medicare space. Eligible dependent children, birth to age 26. We do not offer child-only policies. It is guaranteed renewable. So you're not, dealing with this every year. Short-term medical, everybody liked the short-term medical because you had a stop-loss protection. Probably, a fair amount of a deductible. A lot of people sold our Plus Elite, still are. You don't have any co-insurance for the client once you hit that deductible, which is very nice. However, they got to stay healthy in that plan so you can rewrite them again, whereas this is a permanent plan, guaranteed renewable to age 65. Again, no deductibles, no application fees, pre-existing conditions covered after the first 12 months. And again, you can apply any time. We do in most states. So again, I always refer to the state mandate and also the limitations and exclusions into the brochures. Generally, it's a 12-month look back in most states and then a 12-month wait. One of the big selling points with this, it's going to continue the same network that I actually have as an employee of the company, being on the United Group plan, or if somebody was on a tri-term, somebody was on a short term, depending on the state, they have the Choice or Choice Plus network, the same network. So for somebody that's maybe not subsidized or minimally subsidized, it's a nice fit, as long as they understand what fixed indemnity is. And for those that maybe travel and they want the breadth of a wider national PPO network, which comes with heavy network savings. I think we're north of 1.5 million providers now and north of 700 hospitals. So the plan itself, it can be kind of confusing. That's why when I get through these slides, I always like to go, if you've been on any webinars with me, I always go into our portal because there's just a lot of stuff out there. And I look at it and it's like, you got to do some spring cleaning and organize that a little bit. But I'm going to tell you the exact plans that you could quote on this based off of our big fixed indemnity writers already. So these plans start out with works and then the standard base benefit. We're going to start with the works. Now, we like to overcomplicate things. We give them 3 works levels. Work stands for wellness, office visits, and prescription fills. Not copays, reimbursements for prescription fills. And there's 3 levels to works. I'm going to tell you right now, when you're quoting these plans, I always recommend, and one of our larger sellers of this, always quotes and sells the works 3. He doesn't mess around with the works 1 or 2. All it does is gives some PM relief on a monthly basis between those particular plans. Honestly, between the works 1, the works 2, and the works 3, from the 1 to the 3, it's about a $40 PM, which is really kind of indicative of some of these reimbursements. If you take a look at the Works One, you're getting $80 for a wellness exam, one per calendar year. Excuse me, you're getting 125 with a Works Three. So if you do the simple math, there's your difference of the $40. And if you kind of look per benefit, it's generally around there. Some of the Works One, wellness, and Works Two do not have coverage, but you get reimbursed on all of these particular services on the Works Three. You'll see the colonoscopy, fairly significant difference of a couple $100 there from the 1 to the 3. But it's broken down into the wellness, which is your dark blue or vertical bar there. I don't know if that's a tan or what kind of color that is, for office visits, where it takes you through your doctor office visits, your specialty, so on and so forth. You get a $45 reimbursement on Works 3 for chiropractic. Actually go to the chiropractor. The actual bill prior to repricing, it isn't a network provider, was $75 for my visit. It got repriced to $40. I don't have this particular plan. I'm on a group plan, but had I had this plan, I'd get a $5 bump. I'd make $5 on that visit, 45 and 10 combined for calendar year. And then your prescription fills. And remember, that's not a copay there. That's a fill. So Works 3, you're getting $60 on brand name. You're getting 20 on generics with 20 fills in a year. And more on that too in a second. So that is the Works. That's the first thing you pick, is the wellness, office visit, and prescription fill. Then you get into the base benefits. This is what's going to cover the substantial things that can happen to people. There are 4 plan families within our HPG3: Choice, Select, Preferred, and Premier. I will tell you right now, and looking back at, we've had this product for quite some time. So taking a look back for quite some time, 48% of our HPG sales are on the Choice. So that leaves 52% to be made up of the Select, Preferred, and Premier. You can see our vertical gray arrow that points north. The higher you go up, the higher the reimbursement. Also, the higher the premium. Once I get in and I show you a quote, I will tell you my personal favorite of these plans. It is not the Choice. So more to that come. Okay, here is, I forgot to put a red box around the Works 3. Because now the cat's out of the bag. You can see my personal favorite when it comes to these. Here are your reimbursements. Again, this is $1 fixed indemnity reimbursement per day for a variety of different services, starting up on top with our inpatient hospital confinement, additional reimbursement for ICU, a first in-person day for hospital admission, ER, ground air ambulance. Getting into the surgical, it is a 7-tier surgical reimbursement schedule. And then your outpatient, your labs, your ultrasounds, EKGs, angiograms, stress tests, so on and so forth, MRIs, PET, CAT scans, oral chemotherapy, outpatient chemotherapy. Now, I put a box around the Select. That is the one that I actually show you here in a case study as we move forward. The reason I picked that one, the Select plan is our second best seller, and then followed very closely between the Preferred and the Premier. The Premier is going to be the top end premium, but it's going to give you the most reimbursement. I would quote it. I absolutely would quote it, because you're going to get up to $5,000 a day if that person is inpatient hospital, plus an additional amount if they happen to be in the ICU, plus the $3,000 for the first inpatient day. I absolutely positively would quote that Premier. If you're going to start taking a look at packaging, bundling, putting together a benefit package where we're talking about other ancillary plans to insulate that client, because remember, fear of the stop loss, you can save some of those premium dollars to invest in those other types of plans. I did the Select because it's our second best selling plan. You're going to get more of a reimbursement. You're not quite getting to the average inpatient hospital daily bed. It's around 2,800, but you're going to get to 2,000. So again, it's all in the quoting. It's all where we can remain competitive. By all means, I'd include that Premier on every quote. I'm just saying here the Select is our second best seller. Here is your surgical tier schedule I talked about. So on the Select, you're already at that top end of 50,000 for the tier ones. And then you can see, just depending upon what exactly is going on. One thing I've been asked for already, just in some initial conversations with brokers, Jerry, can you provide some examples on hip replacement, excuse me, fractured wrist, and then of course the bad stuff. And I'm going to reference something that just happened. Actually, a broker of ours who's on this particular plan had a significant diagnosis. We don't have visibility into the claims, that cannot be shared, but in conversations with the broker, we kind of know what some of the billing is, and this really is a kind of a commercial as to why critical illness plans need to be sold with this, but more on that to come. So this is the 7-tier surgical reimbursement. And then of course you can see the assistant surgeon and the anesthesiologist getting a percentage of the actual benefits on that payout too. So as we move through the year and we get closer to our September 1st deadline, whereas we can't sell those other plans, we have to maybe take a look at this or other options. Hopefully we can get more examples too to show if something bad or significant, how would it actually pay out? A lot of it is going to depend on the network discount. That's why you always try to stay within the United Choice or Choice Plus discount. I can say, now we, in full disclosure, we were not on an HPG plan. We were covered by the United Group plan, but same network. And my wife had some pretty significant things that happened over the course of the last, let's just say 6 to 7 years, where there was inpatient, where there was ICU, where there was the C word, some diagnosis there. All good now, which I'm happy to say, but some 6-figure bills coming out of the hospital. And locally here, where she doctored, the average network discounts on those across the board were north of about 60 to 65%. So it's imperative if you do put a client with these plans to stress the importance of staying within that network to reap the benefit of the network discount. Because if you got a bill for $10,000, that bill is not going to be $10,000. That bill is going to be cut down significantly. So at any rate, you guys know all this stuff. There are retention benefits within this plan. I don't know how we got to a bright blue background. Maybe remind me not to forget this, but over time, you keep the plan over time, there are retention benefits built in where you will get increased hospital per days for injury. And I do believe there's similar competitive plans out there that are structured on the same chassis, where if you have this plan in the year 2 and you get into a significant accidental injury type of scenario and you go inpatient hospital, depending on the plan that you selected, you're going to get a bump in that. So before I had Select highlighted, year 2, you move to $4,000 inpatient for injury, up from the 2. If you're on that top end Premier, you're going to go up to 10 grand. So there are retention benefits. The works, obviously you can see there for office visits and wellness, you're going to go from 4 to 6, 5 to 7, and 6 to 8. And for your prescription fills, 12 to 17, 15 to 20, and 20 to 25. So there are retention benefits in it, and for the client to actually keep those plans. It's a $2 million per calendar year maximum, $5 million lifetime per covered person. The claims processing, it does come with an ID card. You present that ID card, point of service, provider will file that claim. Benefits payable to that provider or facility unless the client assigns benefits to themselves. I will tell you, you have to pay for your prescriptions most times. and file that claim. If that pharmacy does take the card, they can file that though. So again, it does come with a card. Thing is, I have to stress this, it's, again, and this is going to be all in the verbiage that has to be put into these fixed indemnity plans. It is not major medical insurance. So even though it comes with a card, it has to be sold as fixed indemnity plans and not the major medical. There are some things this comes with to help protect the integrity of the benefits and the office visits. Some of the best practices that come out of this that we're starting to develop, first and foremost, is this comes with a Health USU by Teladoc with the plan. So what some of the brokers that are selling it is, if you have something and you can avoid going to a brick and mortar so you don't have to to use your office visits, use the telemedicine feature that comes with this. Don't go to the brick and mortar. Preserve those doctor office visits, those in-persons. It also comes with an Optum Perks card where you can go to perks.optum.com/UH1 and reap the significant benefits of prescription discounts. And here's the other thing. When we talk about major claims and why somebody might shy away from actually selling these particular plans, it comes with an embedded, what I would call a concierge service called MedSense post-claims negotiation. So let's get back to that broker who had a significant diagnosis recently. The overall claims are in the six-figure range. This is before any repricing has taken place. We're making an assumption, and based off of the discussions, I don't know for certain that an in-network provider was used. I'm hoping so, because that six-figure is going to get discounted heavily. Once the benefits of the plan are applied, payout happens. Maybe there's a looming bill, a significant bill. MedSets negotiates those bills, get that down as much as possible for the client on big ticket items. Underwriting, it's very simple. Issue or decline. We don't rate up. We don't rider. Those decisions are made individually. And case study. Before we actually go into the portal and I show you these plans and I show you ones that you can quote and kind of not completely forget about the other ones, but I did a case study just in putting this together based off of how some of our distribution partners actually sell this plan. What I did is so this is Orlando, Florida. I took a 40-year-old male. I went out to the exchange. I put in $55,000. So in this particular case, this individual is still getting just under $140 a month in tax credits at $55,000. So not fully subsidized, but subsidized. And I just picked standard bronze plan. Excuse me. This was the first plan that came up on .gov. First one, $257 per month, and this person is looking at a total out-of-pocket of $9,400, which coincidentally, I was having discussions recently, and it was around stop loss. And there are broker agents that are concerned about stop loss. Rarely do I hear, and I do hear it, but rarely do I hear an overall concern on overall out-of-pocket. And again, I do hear it on these particular plans. And in some past presentations, we've used our own survey data where last year we surveyed our agents and they said that the question was asked, at point of sale of your medical plan, did your broker agent mention any other plans? And 47% of them said no. So to me, yes, you could be susceptible to some high out-of-pockets with the fixed indemnity, but why aren't we having as many concerns about the out-of-pocket? So anyway, just something ironic that I was thinking about the other day. In any case, in this Orlando zip code with a gentleman making $55,000, he's looking at $257 in a constricted network with a max out-of-pocket of $9,400. Now, if I would go in and I would quote our select 3. So if you remember, that's the works 3. So I always do that. I always get the maximum reimbursement for your wellness in your doctor office visit. And I'm going to pair that with an accident plan and a critical illness plan. The total premium on this plan is $218. Now, if you remember, we were at 257. Taking a look, we might as well call that 9,400, 10 grand. It's going to be sniffing $10,000 for plan year 2025, or 218. Now, I've insulated this person as best as I possibly can, and I'm going to quote this live, so you're going to see this. I put them with an accident expense guard, which is a guarantee issue accident plan, $20,000 lump sum payment. And then I went to our new critical guard plan, which was introduced Q3 going into Q4 last year. I did a maximum benefit of $100,000. So with that is going to come some simplified underwriting. I know a lot of brokers that sell our CI plans do 5 or 10,000 guarantee issue. After learning about what just happened with that example I was talking about, why wouldn't I quote the max benefit and then pare the premium down if it's too expensive, or depending upon the comfort level of the client? Maybe they don't want $100,000. Incidentally, the benefit amounts that we have are from $5,000 to $100,000 on our lower aged people. $100,000 is the 5th most popular benefit. 5 and 10 are the top 2 because they're guarantee issue. So brokers will add them on to the guarantee issue, followed by systematically, no surprise, 20,000, 50,000, 100,000. Honestly, if I'm out selling this, and it depends on that particular individual, I know that 47% of critical illness claims are for those that are 55 years of age and younger, 47%. I want to make sure I have that discussion and make sure that if they're going to decline critical illness or they're going to take a lesser amount, that we discuss what this plan may do for them. Because in the scenario, the live scenario, we're talking about this other situation, a $100,000 critical illness policy can, along with the reimbursements from the fixed indemnity, can almost, in that case, after network discount, knock out those particular claims. So again, it's not sold. You know, we've been talking about, you know, packaging, bundling, stacking for a few years now. But in this scenario with a fixed I plan, it's imperative to be able to do that. So at any rate, again, you're looking at a national PPO network. You've got 3 different plans here. I haven't even talked about dental or vision or the non-medical products. I just want to talk about an option that can be presented to a consumer and let them decide what way they want to go. They can go, in this case, again, they can go, give me the guarantee issue ACA plan. If something nasty happens, I know I have coverage. Now, that's not to say that all of those, you know, let's say somebody does come down with something. How do I know that's not going to be looked at as experimental? Or maybe they have to go out of network. I don't know. But it is an option in this particular case, right? This is ACA versus the HPG option. So again, I just do this because at United, this will be our option. Obviously, United is in the exchanges as well, and we have our ACA plans. But that's just to kind of speak about what we actually have there. So what I want to do after that case study, information again, is I actually want to go to the portal, and you guys can't see this now. You're going to have to let me know because I'm going to make an assumption that you should see the portal. So I'm going to close out of this. So we're in the portal. If you can't
we can see it,
just let me know. But okay, awesome. So that's the context of the fixed indemnity plan. You guys probably are familiar with fixed indemnity plans. Multiple carriers have that particular option. Totally get it. Just a couple of things. Brand, obviously United Healthcare, network, deep network discounts, a vast amount of providers, doctor, hospital. That's the big thing. In the portal now, and again, just a little review. This is probably redundant. So product availability grid. Here it is. Looks confusing as all get out, but it's by state, by product category. This will have another new look coming shortly. Somebody asked, you guys going to have any new products as you get into September? There are some things we're looking at, not really in as much as a solution to what we're all going to be facing, but some discount dental, mental and nervous type programs coming out. but for something to compete alongside a fixed indemnity, at least to my knowledge, this is what we're going to have to go to market. So a couple of things too in review that I actually want to talk about. Broker sales tools and training. Again, you need more detail that I can provide from a marketing perspective. There are our hospital guard, hospital guarantee issue plans. I want to touch on that too here in a second. So those are the webinars, but I did want to show too, as we talk about the simplified underwriting, just continue to use Florida. Nice place to be this time of year, especially if you're in the north like myself. And let's just take our hospital and doctor plans. We're going to filter this down. This is a discussion for another day. Advantage Guard is for the Medicare space, but here is my HPG brochure guard plan. So you might be like, well, wait a minute. We're talking about HPG. What is an HPG guard plan? Again, it's a derivative of Health Protector Guard. It is not guarantee issue. Again, it does access to virtual. It's a supplemental plan. Basically, it's the same works, same exact works. And again, these plans come with some immunizations, flu shots, and all that type of stuff too. But the guard is really a reimbursement for inpatient hospital, ER, groundwater, air transportation. Guard Plus, go from 500 a day up to 1,000. Additional 1,000 on the first inpatient day, and that is the guard. So to put this in relative terms, I look back over the last, I think it was 2.5 years where we've had the actual product. And if you take a look at guard, our regular HPG plan that we just looked at in my slide presentation, and then the other Giphy, which I'll show you here briefly, the overall HPG makes up 82% of our sales. I mean, people are selling this, but this is strictly a supplement, right, to other types of insurance where you're going to get some reimbursement for your works, the wellness, office visit, prescription fills, and then if you go inpatient hospital. Personally, you know, the guard plans are about $82 per member per month. The HPG plans are about $143. Obviously the higher premier, it's going to be more than 143, but I would sell somebody the top end. Now, again, if you're supplementing some other type of plan, it might be an option. So your other resources out here are your HPG producer guide. You can look through that. It has all things in there, excluded conditions, build chart, other state variations, all that stuff is in the producer guide. There are sample application questions, so you can do a little field underwriting with your client. Here they are, obviously for illustrative purposes only, but this is what you would be looking at going through in the event you're writing an application. And for those of you that are already doing FI and those of you that are doing tri-term and short-term, you're already used to going through a lot of this. Again, it's going to be focusing on a lot of those significant things: heart, circulatory, stroke, COPD, diabetes, AIDS, HIV, cancer, paralysis, schizophrenic, mental and nervous disorders, Crohn's disease, so on and so forth. But you can go out, you can find that sample application right out here. Claims forms, got a claims form in the event that you need that. So a lot of good resources out there for you. I want to go in and I want to get a quote and I want to start. I know we're focusing on the HPG as an alternative, but I do want to show you these guard plans in terms of supplement. So again, I go to my go-to zip code, Florida. We're going to do a 40-year-old male just for quoting purposes. And I'm going to bypass our tri-term. I'm going to bypass our short-term. Take a look at that for confusion. We'll come back to that here in a second. I'm going to simplify all that. It's not even in order. I'm like, what are we doing here? Choice 1, preferred 1. Choice 2, preferred 2. Choice 3. I'll clear that up for you in a little bit. Here are those guard plans. I'm just going to quote lowest premium guard. And then let's just take a look at the highest. And then I would consider this to be kind of somewhat in the middle. And let's just take a look at what those are. So if you're looking to outfit a plan and you want to give somebody some wellness reimbursement, doctor office visits, some prescription fills, and protect them against inpatient hospital somewhat, and some ER and transportation. Remember before I said it's around $82? Here you go. 48, 81, 91. And this would be the top end in terms of your reimbursement. And again, these are made to supplement other medical plans. I know what we do see quite often is I'm going to go back and I am going to uncheck those guards. I not even have known that those existed. Again, these are not guarantee issue. These are guarantee issue. I'm going to quote the hospital guard safeguard and the hospital guard. Then we'll come back to our featured HPG. These are guarantee issue. And again, they're meant to supplement different forms of medical care insurance. The safeguard GI versus the guard GI, $51 for this 40-year-old, $19. I'm going to show you the difference. And we might have done some of this before in the past when we talked about outfitting plans with ancillary plans. The safeguard is going to give, and it just depends, 500, 750, 1,000, 2,000, is going to dictate the daily reimbursement for inpatient hospital, additional reimbursement for ICU, first-time hospital admission, ranging from 1,000, 2,500, a variety of different reimbursements from anesthesiologist, ER, ambulance, and then with the safeguard, you do get outpatient services, doctor office visit, labs, anesthesiologist, you get a wellness reimbursement. That's the safeguard. That's the one that's $61 a month. The hospital guard, you see this sold with like guarantee issue accident plans to ACA members. $19 a month is going to protect you from some inpatient hospital. Again, 500, 750, 1,000, depending upon which plan you select. Additional reimbursement for ICU, a one-time hospital admission, and then the difference between this and the safeguard, you see nothing here for outpatient. It is all inpatient. And again, I quoted the lower level just to get to the premium at its lowest amount there to give some reimbursement, 61 versus 19. Again, those are between these and the other guards. I know we confuse the heck out of ourselves. Those are good supplemental plans to sell. Now, let's go back for the purpose of today and let's take a look at all this stuff. This is what the slide presentation addressed. HPG Health Protector Guard, all these different variations between your Works 3 and your 4-based plans. There's 12 of them right here. Way too much. So what I always say is do this. Get the lowest premium plan visible. Take that choice plan. Remember I said 48% of our sales are on that plan. It's because people are selling by premium. I personally, unless they're selling that as a supplement to another plan, which they may, because a lot of people will sell this or a variation of this along with the short term for the stop loss, they're going to want a lower premium reimbursement. But what I'm going to do for today, I'm going to take that select plan, always 3, always Works 3. I'm not going to try to save $40 a month on this particular offering by going to like a Works 1 or 2. I'm going to Works 3, and I'm going to quote that Premier, high-end Premier. That's the $5,000 reimbursement for inpatient hospital on Works 3. Now I'm going to do something else here. Actually, no, I'm not. I'm going to come back and do that. I want to give you some visibility to the premium on this. Again, this is in Florida, Orlando. Okay, here we go. Choice 1, that's the lowest level reimbursement. If you remember, that was $1,000 per day in the hospital. That was the slide that was in the presentation. I'm going to go ahead and bring it up. There's our Works. Remember, here's choice, $1,000 a day. Select is $2,000. Premier is $5,000. And they double for injury in the second year of the policy. Remember that. So 1,000, 2,000, 5,000. Preferred, we didn't quote that. I mean, suppose we could. Let me actually, I'm going to back up. Then what I'm going to do is I'm going to take some of these out of here. And I'm just going to go with that select that we quoted for that 40-year-old gentleman against that ACA plan. So if I do and I can only quote 3. Yep, that was the other big thing with us. The other choice was $81 a month. Let me take the preferred 3. Choice was $81 a month, and that was for that lowest tier reimbursement. If I take a look at the next 3 runners up, lowest to highest, my select 3 is $142. That preferred is $171 with a $3,000 hospital daily benefit. And then the premier 3 for $5,000 a day is $211. So again, you put this up against partially subsidized or unsubsidized ACA, it can become an option for somebody, again, with a stronger network. Obviously, for those from a health consideration that have significant pre-ex and they have significant health situations, this does not compete, again, because of the simplified underwriting. But what I want to do here for the benefit package that we just created for that 40-year-old within our presentation, I'm going to put him with an accident. I'm going to our full-blown critical illness over that of the cancer, heart stroke. This full-blown critical illness is 85% of our sales within this plan family. So I'm going to quote that one. I'm going to take a look at this. Here we go. So this is the plan I quoted in our presentation. I am going to bump this amount on this accident expense guard, which is a guarantee issue plan, to the max benefit. It's going to go from $8 to $16. I'm going to put that in the cart. So if this person has an accident, they got a $20,000 lump sum accident plan. I'm going to go into the critical illness. It defaults to the $5,000 guarantee issue for $5 a month. Now remember what I did with respect to that individual who's going through some significant claims. I quoted the top end of that. So you see it, you get just this bar that comes up. Benefit chosen is going to require health questions because we are now in the simplified underwriting environment. And again, you can find those sample apps on the portal, $60 a month. Let's just say the person, you're trying to be conscious of premium, and remember what I said, 20,000. Once you get above these, 20,000 is our next best chosen, most frequently chosen. You're up to 13. Remember I said 50 then in order, 31, and then of course that 100. So let's just say the person, there's no family history. The 40-year-old says, I got no family history, no real worries, but yeah, maybe just to put something on there, you do $10,000 for $9 a month. And in the presentation, we actually did the 60,000. And then we're going to go to, we're going to put our select in there as well. This is pretty much what we did in the presentation, except I lessened the amount of critical illness. So in this case, we're under $200 now in this particular option. And you could have gone to the Premier if you wanted to actually show that. Put the Premier in. I think that was our 10 or 10. So we do that. I apologize. And there we go. So we'll just say that this person just wanted $10,000. So now what we did is we just kind of, there's probably a slicker way of doing that. I'm at 235, which was close to where we were at, probably about $18 more in that example we had in the presentation, but I went from the select to the premier, top end, $5,000 a day, reimbursement in the hospital, $20,000 in accident, and $9 for $10,000 guarantee issue critical illness for 235. And again, in case I always forget to do this, in this portal, you can always send this to the customer, but if you're at point of sale and you click on Start Broker Assisted App, put the person's name, phone, email. There's two versions of this. The old traditional original where you send it to them, they put in their banking information, and then maybe they have an appointment and they leave, they had to hang up the phone or the meeting is concluded, and now you got to chase that particular client. Or you can simply do the assisted security application where you are establishing two questions. What street did you grow up on? What was your pet's name? What was your best friend's name? Some variation of that. You take their banking information, and by reading a word for word impromptu, that is their attestation by agreeing to that, where you take the entire application on their part. They do get an email, obviously, but then you control it cradle to grave. So I always have to throw that in. But really, that is our option. That is going to be come 9/1 what we actually have. Again, you're going to get probably some, additional type ancillary offerings between now and then with us. You're going to see a massive buy now push for tri-term and short term in the very near future. We have one last crack at it before 9/1 gets here, and then let's just see what happens in the future. Maybe it's a deja vu all over again as we move into 25. And generally, no matter what happens, if you recall the last time we were constricted to 90 days, it did take a bit to be able to get to full duration short term and to get that 3-year option. Things like that move slow, but who knows what plan year 2025 looks like. But for now, this is kind of the way it's been drawn up on the scorecard, if you will. And we look to really promote the FI policies as we get to the latter part of the year. But with that, that concludes today's presentation. Again, look for more of this, probably with examples as we move through the year. But with that, that is the content for the presentation. So I don't know if there's any questions or comments.
Awesome, Jerry. Thank you so much. Want everybody, if you have a question or comment, throw it in the Q&A or throw it in the chat, and we will get to it. Yes, we are recording this, and I will put it up in Leadmaster after I edit out the beginning, where there was nothing for 20 minutes. I will let everybody know.
Oh yeah, and I forgot too. I apologize. So oftentimes we'll get asked if we can provide copies of the slides. So these aren't stock presentations that we do. All the ones you see out on the portal under webinars on demand, those are stock, right? Those are pre-approved. They go through a very strict compliance. Some of the things I put together are not, so I don't forward these out. But again, I would refer you to the broker portal because there's just so much information out there. And if you need help accessing something somewhere, just by all means, let me know. I don't have a problem with that.
All right, got a flurry of questions coming in here. Is there somewhere to see the surgery benefit schedule in more detail?
I would go to the broker guide for starters, and I can look as we move through the year to maybe get some expanded detail on that, but I would refer you there for starters.
All right. Is the underwriting similar to what's currently used for short-term plans?
I would say yes. They're going to look at meds and stuff like that a little bit more because after you get through that first duration, it's not a duration. I got to get my head away from tri-term. After you get through that policy year one, because it is a permanent plan that's renewable, they're going to be a little bit more strict. And if you take a look at the app, they're going to be really kind of curious as to what's going on if somebody's on meds. It's very similar, but it might just be a little bit more because it is a permanent plan.
Awesome. Jerry, got a couple people asking, can you throw your contact information in the chat so they can have it in case they need to reach out to you?
Oh, yeah.
Great. Thank you.
Yeah, for sure. Let me do that right now.
So make sure it's out to everyone, and then it'll be in there for everyone wondering.
Yeah. Wagner at UHC.com. I'll put a phone number in there.
And then while you're typing in the phone number, what is the annual max benefit on the HPG 3?
Yep, 2,000. I'm sorry, 2 million. 2 mil. 5 mil lifetime per person. Yep.
Oh, that's awesome. Will we be able to add products with tri-term after September 1st?
If it's like ancillary type products, yeah, I don't see why you wouldn't be able to do that. There shouldn't be any restrictions on that.
Will this automatically term at age 65?
Yeah, they'll get notice. So it'll be 64 in 11 months in there. They're going to get a notice that will term because it does not transcend into that senior space.
All right. Getting a lot of kudos to you, Jerry, for an awesome presentation. I had a client had a client have a knee procedure on this plan, and the network adjustment alone brought the procedure from 39,000 down to 19,000. So a little tidbit there for Brittany.
That is a great testimonial. Thank you. Because that's the thing, and I get it, right? I'm not going to go back and talk about the whole stop loss thing again, but what I try to implore upon people is you take a look at that network discount. You're not dealing with that 10,000, 25,000, 50, 70, $140,000 claim. The repricing in itself is very advantageous. You still have to address the elephant in the room. I get that, but that is a fantastic testimonial. Thank you.
All right. Is this product available before 9/1? Mark apologizes if you've already answered this.
Oh, yeah. You can go out and sell fixed indemnity all day, every day right now. You bet it is.
All righty. Looks like that's chat is disabled. Can you read off Jerry's number? I didn't know the chat was disabled. That's weird.
Oh, shoot.
Yeah,
I can do that for you.
Okay, perfect. Thanks, Jerry.
Oh, yeah, I'll do it. So my email is Jerry, Jerry, .Wagner, WAGNER, Jerry.Wagner at UHC.com. UHC.com. Phone number is 920-661-1359. 920-661-1359.
Awesome. We're at the end of the question list. Anybody want to throw in one last question before we... Oh, here comes Misty. Is pre-X covered for 12 months? Is that what 12-month look back and 12-month wait refers to?
Yes. Answer is yes. Pre-X covered after 12 months.
Right. Perfect. Anyone else with the last question for Jerry before we end the webinar? All right. Well, thank you again, Jerry, for your time and incredible presentation.
You got it.
All
Thanks
right,
so
everybody.
much. Thanks for your time. Take care, all.
Everyone have a good day.